Hello.
Hello, good morning.
Good morning. I'm Dr. Adil, one of the junior doctors working in this department. Can you please confirm your name and age for me?
Hello, Dr. Adilia. My name is Amy and I'm 40 years old.
Okay, Amy. Nice to meet you.
Nice to meet you too, Doctor. Thank you.
Amy, I know that I understand that you came last week, 2 weeks ago for the checkup, and the tests were done on you. And now today you're here for the test results.
Yes,
Am I right?
Doctor. Yeah, that's totally right. Yeah. Can you tell me the results, please? Yeah. I'm a little bit
Okay,
worried about
Amy,
that.
the results are with me right now. Um, uh, let's talk to your health first, so that I have a better understanding. So what's happening, so that I can tell you in a better way. Is that okay?
All right, Doctor. Yeah, you can.
Okay, Amy, could you please tell me what brought you to the hospital in the first place 2 weeks ago?
So, I have seen your colleague 2 weeks ago because I was having some weight loss. I'm losing weight continuously without planning to do that. I'm eating everything under earth, but I'm not gaining any weight. I'm losing weight.
Okay, all
And
right.
as well, I started to feel some shaking movements in my hand, which is troubling me a lot with holding things. Yeah.
Okay, all right, all right. I can see this. So, was there any apart from this? Was there any diarrhea you had noticed, or?
Diarrhea, yes, yeah, I think on and off diarrhea, yeah, it's a bit more loose than usual. I think so, yeah.
Okay. How long have you been having, you notice having weight loss?
So it has been for the last 2 months at least. So at
Okay.
least 2 months, yeah.
All right. All right. Uh, how much was it of the weight you have lost? Have you
I
noticed that?
think I think in the last 2 months I lost like 5 kilograms at least, yeah.
Okay. All right. Was there any fever along with it, or just weight loss,
No fever at all.
or any lumps or bumps in your body you might have noticed?
No, I don't think so.
Okay. All right. Any medical condition you have already been diagnosed with?
No, just high blood pressure. I have been
All
having
right.
high blood pressure, but it's controlled, yeah.
Okay, okay. Could you please tell me, Amy, what have you been taking for your blood pressure?
No, it's only controlled conservative. I just cut down on alcohol and smoking and caffeine, and it has been fine.
Okay, okay. Apart from this, like specifically diabetes or something,
I know I'm not diabetic now.
or asthma?
No, I'm not asthmatic as well.
Okay, okay. Amy, you are not taking any medication. Is that all right? Or apart from this, any other medication you have been taking?
No, nothing at all. Yeah, just
Okay,
over-the-counter painkillers when needed. Yeah.
okay, okay. Could you please tell me, Amy, how much of the coffee and coffee you take?
I did already cut down, so I'm not taking any coffee anymore. Yeah.
Right. Yes, yes, you just mentioned that. I understand. I just want to ask you that how much you're taking now as compared to before you were taking.
Coffee, I'm not taking any coffee at all. I stopped
Okay.
totally caffeine intake. Yeah. I only
Okay.
drink
How about?
tea 2-3 times a day.
Oh, okay. So, pardon, how many times a day?
2-3 times a day I drink tea.
Okay. Okay. All right. How about alcohol? Do you take alcohol as well?
Only like 2 units a week. I did cut
Uh,
down as well.
okay. Okay. And smoking?
uh, I'm a light smoker, maybe like 2-3 cigarettes in a week, not very often. Yeah.
Okay. Okay. All right. Amy, could you please tell me what do you do for a living?
Doctor, I work as an accountant.
Okay. Okay. Has it been affecting your life as well and your work life
Yes,
in any way?
yeah, as I told you, like this hand shaking, it has been affecting me typing on the computer. I get tired very easily with that. Yeah.
Okay, okay. I can see it must be very annoying and difficult dealing with it.
Yes,
Well,
very.
come back to this shortly. We'll discuss this in a more detailed way.
Yeah, I'm very
And I
worried,
see.
doctor. Like, is it like, what about the blood result? Is it very serious? Are you worried about anything? Because I'm worried
Just a few
because of
more
this
questions.
question.
I'll get back to your results. Will that be okay?
All right, yeah.
Okay. So how, apart from your work life, I would like to ask a few questions of your personal life about this. In any way, has it been affecting your sleep life as well?
Oh yes, yes, that's a good point, doctor. Yeah, I'm sleepless now. I can't have a good sleep at night. I'm always irritable. I sleep 2 hours and then I had to wake up because of being irritable and anxious as well.
Okay. Okay, I mean, are you sexually active?
Yes, doctor. Yeah, I'm married.
Okay. Okay. So anyway, in any way, it's affecting your sexual life?
No, no, not that much. Yeah.
Okay. Okay, glad to hear this. Okay, I mean, I would like to before discussing your results, I would like to check your vitals,
Mm-hmm.
including your heart rate, blood pressure, and respiratory rate. Uh,
Mm.
and I would like to do a general physical examination, including a thyroid examination, your examination of
Thyroid?
your
What is thyroid? Sorry.
it's a gland in your neck that is responsible for producing a hormone called thyroxine. And so I would like to do that examination.
So where where
Uh,
where where is this gland? Where exactly is that?
I mean, it's a small gland in the lying in the neck.
All right. So you would like to
Right.
examine my neck? Oh, that's
Yes.
fine. You can examine my neck.
Oh, okay. Thank you. And I would also like to do heart examination and respiratory examination. Will that be okay for you?
Respiratory? What do you mean by respiratory?
A chest examination.
Oh,
Pardon.
like okay, yeah, I'm fine with that as well.
Okay. I would also like to do an ECG for you, the electricing of your heart.
All right. Okay. Yeah, you can do that, doctor. Yeah.
Okay, so
So examination finding are all right. Heart rate is a little bit high. It's 95, and ECG sinus tachycardia.
okay, okay. Amy, from the results, from the symptoms, and from the examination you've told me so far, and the results that are with me right now, uh, it is you have been having a condition called hyperthyroidism.
Mm-hmm.
Have you? This is something. Have you heard about this before?
No, I'm not that much educated. Can you tell me, please?
Okay, okay. This hyperthyroidism is a condition. Yeah, when your thyroid gland
Mm-hmm.
starts over functioning, and
Mm-hmm.
it produces a hormone called thyroxine in
Mm-hmm.
excessive amount. Thyroxine is a chemical that is produced by the gland,
Mm-hmm.
which is usually responsible for your metabolism, like your heart rate, your sleep patterns,
Mm-hmm.
your daily body reactions, and
Mm-hmm.
your digestions, and all metabolism.
Mm-hmm.
So once it is
Good.
produces, when it's produced in excessive amount, so you it matches the sign and symptoms you have suggested.
Sorry, I need to stop you now. Yeah. So the time is finished. Yeah. All right. Yeah. All right, Adelia. So well done. Okay, you have taken good history. Okay, but we have few comments for improvement for history taking. Okay, so I'll start
Okay.
with data gathering, then interpersonal skills, then management. Okay, so for data gathering, you know what question you would like to ask, but there was no structure in the history taking. It's better if you have a specific structure so the examiner knows why you are asking this question in this set of time. So for example,
Okay.
you start with the presenting complaint and you elaborate that one. Okay. After presenting complaint, you can ask about red flags, okay, or other symptoms related to thyroid if you are thinking about thyroid. Okay. And then you can go to the like general questions like past medical history, medication, allergies, and the family history as a set of group of questions. And then you can ask about the lifestyle as you did. Okay. And then
Right.
you can end that with asking ICE, what do you think the results might
Right.
be?
Right.
Are
I
you worried
missed.
about anything specific? Was you hoping for anything for me to do for you today? So if you have a specific structure of your own, the examiner will feel smooth to follow you, but you was asking one question from here and then you remember another one later, so it was a little bit haphazard. Yeah. Okay, so if you can
Okay.
make them more structured, that will be much better. Yeah. Okay, we have I mean, there were a few symptoms that you needed to ask about. You didn't ask about the heart racing at all, and it's one of the common features of hyperthyroidism. Okay, you didn't ask about any period changes at all. You didn't ask about any mood or irritability, and I did mention that I'm irritable, and you didn't explore that.
Yes.
You didn't ask
Yes.
about the eye, about the neck swelling. Okay, So there were few questions that needed to be asked related to thyroid problems itself. Okay, so usually thyroid, as you know, you can start from head to toe. Eye changes.
Okay.
Is there any eye changes? Okay. Is there any problem with the swallowing? Is there any neck swelling or neck lumps? Is there any nausea or vomiting or heartburn? Is there any change in the bowel habits? Any periodic changes from down below? Overall, do you have any weight loss? Any mood problem? So you will be covering everything if you think about head to toe. Okay. So otherwise, data gathering, I would recommend and advise you to make it more structured. Okay. And
Okay.
symptom wise, try to cover as much as you can from symptoms and differential diagnosis. Let's go to the second domain, your interpersonal skills. Okay. In the beginning of the consultation, you didn't show any sympathy or empathy. You did show sympathy at the end. Okay. You said it must be stressful. I'm very glad that you have good sexual life. But in the beginning, when I was complaining of my symptoms, you never said, I'm sorry to hear that. It sounds very stressful for you. Are you coping all right?
Okay.
You have done that in the second half, but in the first half, it was much needed. Yeah. The
Okay.
second thing as well in interpersonal skills, you didn't cover eyes. You didn't ask about
Yes, yes, I
idea,
missed.
concern, expectation, and you didn't engage me. Like you didn't engage the patient to think with you. So make it like two-sided conversations. Whenever you say
Okay.
something, ask her, what do you think about that? Do you have any idea about that? Are you happy for me to do that? The third thing in interpersonal skills, some cues you missed them. I said many times, I'm worried, I'm worried, I'm worried. You need to
Yes,
ask
yes.
me. Once I say I'm worried, you ask me why you are worried. Are you what are you worried about? Okay, maybe I'm worried about cancer. Okay, so whenever I
Right.
say worried, you stop and reflect this back to me. Okay,
Okay.
as well in interpersonal skills or data gathering, they both together, you have mentioned lots of medical jargons. Okay, you said
Yeah.
thyroid, you said ECG, you said respiratory. Patient doesn't know that. Okay, you are
Yes,
not
yes.
talking to a doctor. Okay, so if you are talking about respiration, can I examine your lungs, please? Even chest, say, can I examine your lungs, please? Okay, can I do heart tracing for you? Okay, thyroid, when you talk about thyroid, can I examine the glands in your neck, please? So it will be more simple to the patient to understand. Okay,
Okay.
we didn't have time to go for management, so time management should be more better. Hopefully next time, don't worry, we'll do that. Okay, and then
Right.
you started to explain hyperthyroidism. Okay, I know you know hyperthyroidism very much, but try to make it more simple. Try to use a very simple language. Okay, because your patient might be mentally retarded, or sorry,
Yes.
mentally disabled, yeah. Or maybe like homeless patient who doesn't care about these medical terms. Yeah, so you can say, Mr. Smith or Amy, I think you have a condition called hyperthyroidism. Do you know what is that? No, doctor, I don't know. Okay, you can say we have a gland in the base of the neck, and this gland is controlling how is our body functioning in the correct rate. And in your case, this gland is overactive. Are you following me? Yes, doctor. Yeah. So overactive means that your body is functioning at increased rate. That's why
Okay.
you have more loss of weight. You are being more irritable than usual. So just make it very simple, okay? Otherwise, in the management domain, as we said, if you had time, I would be able more to comment here. But I'm sure you know how to manage hyperthyroidism. Yeah? You know about beta blocker for sure. You will counsel her about that. It's for reducing your heart rate, okay?
Right.
And it has this side effect, and you mentioned that, okay? And you will say that you will refer for a specialist for a special anti-thyroid medication, okay? And you can give an idea about medication like carbimazole. It works by reducing the hormone level, and side effects like, as you know, like reducing the blood count, and we need to follow this side effect. Okay, and you can talk as well about regular monitoring, that we will be doing regular follow-ups for you. We'll be checking your hormones in regular basics to make sure we are controlling them in the right and correct way. And you will safety net here at the end as well about the carbimazole, the medication. Okay, and you will
Okay.
safety net here about the thyrotoxicosis if she ever has any serious symptoms to call you back. And you can give a leaflet if you still have time. So
Okay.
overall, very well done. Okay, you have only a few points to work on. I mean, with practice, I'm sure you will get them done. Okay, so just to
Sure.
recap everything: data gathering, make it structured. Okay, make sure you ask
Okay.
everything in its own place. Okay, and make sure to explore ICE in data gathering. In
Okay.
interpersonal skills, make sure not to use any jargons. Okay, make sure you
Okay.
respond to cues like I'm worried doctor, I'm happy doctor, I'm sad doctor. You reflect back why, so she can answer. Okay, make it two-sided consultation. Whenever you say
Okay.
something, see the patient reaction. What do you think? Are you happy for me to do that? Okay, for management, as we said, we didn't have that much time to comment on management, but use simple terms in management at the end of the day. When you give a diagnosis, when you say management plan, it choose a very simple word that you can use so the patient can understand and can be in the same page. Otherwise, well done.